Thanks, Seb. Thanks, our Weave team. We're happy to be here today, and here we're here to present on FMD systems. I'm Sean Alfreds, and I'm joined today by Todd Kitchens, and we're here. And today we're going to present on next with our combined 30 years experience in healthcare, how FMD is going to disrupt the U.S. healthcare system by putting data back in the hands of patients. I think everybody here is aware that the U.S. healthcare system is pretty broken. Next, the U.S. healthcare system is the most costly in the world, yet we have millions that have no insurance. Huge administrative burdens, clinical burnout, and mediocre healthcare quality. Next. The factors contributing to this broken system include the fact that corporate interests, hospitals, health insurers, others, control how the system works and have every financial interest to keep it this way. How do they do it, you ask? Well, while there's lots of complexities, as you're all aware, the reality is it all comes down to data and information. They control the information flow. You, me, as patients, don't own our medical record data. They do. Next slide. Todd, I think we're next one. But let's say you're not super happy with it. Let's say currently the situation, the system works like this. When you go to the doctor to get treated for, let's say, a broken arm, the doctor adds to your medical record on an electronic system, and only enough data goes for a billing or payment is sent to your insurer. Next. But let's say you're not super happy with that doctor or that hospital, and you want to go and change to a different hospital. Porting over your information is not as easy as it seems. Hospital A may not share with Hospital B, or do so at a slow pace. Sometimes you have to actually ask for your medical record information and even have to pay what they call as a quote, reasonable fee for retrieving your records. Next. And this whole dynamic happens again at the insurance company level. Next. But change is coming. In 2018, a number of regulations related to medical data ownership were passed and are all about to kick in this year. At a high level, what those regulations mean is that all healthcare providers will be required to provide open APIs for patients to access their data. Not only that, these APIs require a transport standard as well as a content standard. Next. This is awesome news for us. This is a huge step forward, but what's still missing are tools that patients can use to store their data permanently, securely, and in a way that allows them to then control who has access to it. Currently, there's nothing in the market, and these regulations come into effect later this year. Healthcare providers are sort of asleep at the wheel when it comes to these things because they want to keep the system working as it does. But we work in the system. Todd and I both are sitting here, and our day jobs are working in this system, trying to break it as we go. Next slide. But this is why we've created FMD. Next slide. FMD, at FMD, we're creating a blockchain-based NFT health record ecosystem on Arweave, using the inherent security of the blockchain, the permanent storage of Arweave, readily available encryption, and smart contracts to allow the consumer, the patient, to take control away from providers and insurers, and allow us as patients to actually control our data by leasing it back to them so that they can do their jobs. Next slide. FMD systems solution includes both on-chain application ecosystem as well as an off-chain application ecosystem. On-chain, we've got permanent storage for data through an NFT-based revenue streams, end-to-end encryption, and key cycling via the Accord API, and DApp-enabled control or access to the NFT health records, basically a key exchange to support what we're calling NFT leasing and commerce. Off-chain, we've got two-factor authentication, patient identification, and patient record locator service using GraphQCs, anonymizing and creating a pseudonym of the record for deployment on the blockchain, and FHIR-based API data services to be able to pull the data from the health records. Next slide. The shifting of ownership creates a means by which the patient can monetize their healthcare data for use by the insurance and provider marketplace. It flips healthcare on its head in the US. These players will still use the data for their business practices, but the patient now controls what and who and when they can use it. The revenue streams are really interesting when you start to look at this. The patient can monetize their data across and receive transaction fees for every single transaction. Middle layer applications, FMD plus others on the chain can on the ecosystem can create value-added API structures, and then the insurers and providers create a business-to-business structure where FMD can both monetize to those organizations, but also use those organizations as rapid enrollment systems where we can get millions of patients to join FMD through one contract. FMD will move the control back to the person and the incentive back to the provider insurer to be better stewards of our wellness rather than making money off of our sickness as they do today. Next. I'm now going to ask Todd to give us a quick demo of what we've built thus far. So Todd, why don't you go on and pull up the demo?
Great, thanks, Sean. You can hear me okay? I can't
Yep.
see make sure I'm unmuted. Great. So I'm going to give a brief presentation of the core functionality of the FMD systems application. And the first step is I'm going to log in as myself. And in this scenario, I'm the patient or the owner of the NFT patient data. And what you'll see straight away is that, it welcomes me to the page, and then underneath there is a pseudonym ID. So this pseudonym ID is actually minted into an NFT. And I'll just quickly demonstrate that or show you what that NFT looks like. It doesn't look like much, but it does show you, the pseudonym name. It lists the PST token name as FMD patient 2, and then there's my wallet that shows ownership. Next you've got the My Data tab here. You can see that I have no new data to import at this point in time. And then there's a list of viewable data, right? So there are a bunch of files here. I have access to everything. And what I've done is I've shared my data through what we're calling leases, which is essentially the sharing of a decryption key with users that I choose. And you can see that this first user here, they had a start date of June 1. It ended on June 28. So their lease is complete. And then there's a second viewer that started on the 28th and goes on to the 15th. Okay, so I'm going to log out here. And I'm going to log in as the first viewer, which is the customer, right? And you can see here, again, there's my pseudonym, right? So I'm the one that shared the view access rights to this customer. And you can see that their lease has expired. And they only have access to this first file, this helloworld.txt file, because it was shared June 26. And these files are all being accessed via the Accord API, which connects to our Weave network. And all of the other files here, which, in the final deployed version, customers won't have access to, or they won't even see these files because we will filter them out. But I left them in here for the purpose of showing that they actually clearly only have visible access to the one file, and the other ones are screened out and they can't access it. So if you click on the one, it takes you to the Hello World document. It decrypts it, and it's again, it's end-to-end decryption via the Accord API. And I'll go back here. And yeah, so I'm going to log out as the first customer here, and I'm going to log in as the second customer. And you can see here that there are two active leases, right? They have both shared by my pseudonym. And the first lease, again, ended on the 28th, and it's complete, but they still have access to it, right? Because the new customer, the new lease, gets all the past data and then the future data as well, right? And then they have access to everything from June 28th, and we set it to be good through July 15th. And you can see here that they have access to all of these records plus the old record. and I'll just demonstrate what it'll look like for one of the patient health records. And if you click on the ID, the transaction ID here, it would actually download the decrypted file. Great. So I'm going to log back out here, and then I am going to switch back to Sean to finish the presentation.
Great.
Take it away,
Thanks,
Sean.
Todd. Thanks, Todd. That's super cool, and we're really excited about this, as you can tell. We came up with this idea back in February this year, after years of experience in making interoperability work within the healthcare systems, but always running into the problem where patients have no control, and the business interests of the providers and insurers, which sometimes are most of the time misaligned with our interests as patients, get in the way of sharing. Next slide. So 1.2 million. This is the number of patients that we believe in the next 6 months we'll be able to enroll in FMDS, based on the organizations that we're already working with, and able to engage in exploring this. And these are insurance companies. These are providers. Next slide. We came up, as I said, with this idea in February. We've begun, as you can see, we've got this. Todd and our team has built this to the point where we're it's actually real, and we can leverage these standards that are coming out this year. Healthcare is so complex, and we talk about legal contracts with the previous presenters here. This is an area where it has been really difficult, but it's because of these new regulations that we're able to move very quickly this year. Next slide. So our roadmap is pretty straightforward. This year, we're developing the prototype, socializing the business concept as I've described. We've got our business plan, and we're seeking out seed capital right now. During 2023, that's our V1 development of both the on-chain and off-chain software in our pilot rollout with our V1 clients. And then as we push through to mid 2023 and into 24, that's when we're enhancing. We're starting to roll this out and looking for stage A development. Next slide. So quickly, just to end this, I just want to tell you a little bit about ourselves. I'm the co-founder of FMD Systems. I've been working in healthcare interoperability for over 20 years. Over the past 5 years, I have been and continue to serve as the executive director and CEO of the Health Information Exchange in the state of Maine. We work with over 900 different healthcare organizations using a distributed IT system to support coordinated care, reducing errors, assessing risk, promoting quality care, and making real-time data available for providers around the state. We also have a for-profit subsidiary where we take what we've done there and the software we've developed and deploy that nationally. And because of these issues, though, we found that we've got to create different structures. And what we've done with permanent storage, and with these new regulations, this is a whole new opportunity for us to free the data. FMD, free my data. So that's who I am. I'll ask Todd to introduce himself and his experience.
Great, thanks, Sean. Hi again. I'm Todd Kitchens, co-founder, chief information officer, and chief medical information officer for FMD Systems. I have over 12 years of experience as osteopathic family medicine physician. Practicing academic medicine at a training program for medical residents. I hold clinical teaching faculty appointments at the University of New England, Boston University, Tufts, and the University of Vermont, and have completed a fellowship in integrated medicine at the University of Arizona, Andrew Weil Center for Integrated Medicine. And I've served in multiple leadership roles in academic medicine, both locally and nationally. My prior career was in brand design and web development, and have a strong interest in how digital health technology can serve a critical role in the health of individuals and populations. And I'm super excited to be working with Sean and the RWeave team. So thanks everyone for your time. Back to you, Sean.
All right. Thank you all. I want to just give a quick special thanks to a few folks that have helped us through this, our initial efforts, including Jeremy Dose for help with the DApp development, Richard Veronica and Pascal at Accord, and the Arweave community on Discord, including Dan McDonald for the technical and moral support, and Tom Wilson for the help with SmartWeave NFT contracts. And of course, thank you to the Arweave team, Sam, Seb, Jesse. We really appreciate your time today.
Yep, and please come and visit us during the Mingle session. Look forward to it. Back to you, Seb.